Good evening, everyone. My name is Dr. Adazayon. I remain your obstetrician gynecologist. I'm back again to our channel to discuss about obstetric fistula. Before I go on, I want to thank as many that have subscribed to my YouTube channel. I want to thank those that have followed this page and those that are liking and sharing, commenting. I am grateful, super grateful. Please, if you have not, please subscribe, like, comment and share. Don't allow me to come to your house. Thank you so much. Let's go on. Obstetric fistula is a communication that happens between the vagina and the bladder, or the vagina and the rectum, causing leakage of urine per vaginum or leakage of feces per vaginum. It's the commonest condition that leads to it is childbirth and delivery. Now, there are other causes. In fact, we have made a study. Initially, it was labor and delivery that is the commonest cause of obstetric fistula. But in my environment, southeastern states where I practice, the commonest cause now we have found that is cesarean section. I'll come to that because most women now enters the hands of unqualified people that just section them, and issues arise because it was not done properly. Anyway, let me not go to that yet. Now, we have two types. We have vesicovaginal fistula and rectovaginal fistula. In vesicovaginal fistula, let me explain as much as possible to the understanding of everybody what happens. During delivery, this is the head of the baby. This is the vaginal wall where it's coming from. Now, remember, it's like this. As the head is trying to come down to be delivered, and something happens, maybe the passage is not enough, or the head is bigger than the passage, what will happen is that it will get stuck at the middle. There's a bone here we call pubic bone. Is in front. If you touch your waist, front of your waist, you will see that bone. That pubic bone is in front. Now the bladder is following it before the head of the baby in the vagina. Now what will now suffer is that the head, which is strong as a stone, with this pubic bone, which is also strong as a stone, now impedes, compresses the bladder and the vaginal wall together. Now the bladder, these soft tissues will now lack. There was this occlusion will stop blood supply to the bladder. Now the bladder will start suffering. There will be no oxygen supply to the bladder again because the head and the bone is impeding its supply that carries oxygen to it. Now, if it's not relieved immediately through another route, most especially from abdominal delivery, that is cesarean section, what happens is that that part of the bladder where the head is compressing against the pubic bone will die off. It will die. As it dies, cell death has occurred. Because cell death has occurred, whenever you relieve this head that is obstructing the blood flow, the next thing that will follow it will slough off. It will come out. It will now slough off, and there will now be a communication between the bladder and the vaginal wall. Now, the urine that is supposed to be coming straight to the urethra will start flowing through the vaginal wall, and that gives you vesicovaginal fistula. The same thing happens backwardly, and it will give rectovaginal fistula. Feces will now be, a communication will now arise between the rectum and the vaginal wall, and feces will now be coming from the opening. The person will now start leaking urine or start leaking feces. This affects women. There is no man disease in vesicovaginal fistula. Let me say it like that. Reproductive women, young women, women that still have beautiful life ahead of them. Now, poverty is one of the leading causes to vesicovaginal fistula, to obstetric fistula. That is why you have a girl child, please, I beg you, train that girl child. The least she could get is secondary education. The least you will give her is secondary education. If you have money, please train her to the university level. Empower her. Let her not run into marriage without doing anything. Delay in getting the best care gives obstetric fistula. Before they will come to the hospital, the deed has been done, the tissue has been damaged, and you start patching it up. Now, when this happens, it can also happen higher up, between the uterus and the bladder. You now see urine entering the uterus, or even menses entering the bladder. The person will not be seeing her menses through her urethra. Vesicovaginal fistula is traumatizing, and most of these women are stigmatized, which is not good. It's not necessary. It's not something palatable. I work where we manage vesicovaginal fistula patients. You will see them not eating well, anemic, because they are trying not to drink more water so that they will not be staining themselves with urine. It's all over. Though it's more here, we've had patients all over the country, and even from outside the country coming for treatment. What I want to tell you is that it is manageable. If it's the ones that, you remember I said initially that the commonest cause we now found that is cesarean section, because most women are now going to hospitals in the village. The next thing that you see one quack trying to cut their abdomen open, and the next thing the person is cutting the bladder because he doesn't know the tissue that is bladder tissue from the uterine tissue, and we patch everything. The next thing the woman comes up with vesicovaginal fistula. So please, when you are pregnant, register in a qualified hospital that has qualified personnel, so that if we are seeing anything like obstructed labor, cephalopelvic disproportion, we are taking you straight to bring out that baby and make sure we give you a good outcome. If we are able, if peradventure someone makes a mistake and has ruptures or cuts the bladder, the person is repairing it immediately, and at the end will rest the bladder, and bladder heals. Bladder is a very forgiving organ, very, very forgiving. If you do the right thing, we will forgive you immediately, and it will be as if nothing happened. Now, for those that already have VVF, please refer them to any obstetric fistula center all over the world. We have one at Katsina. We have National Obstetric Fistula Center at Abakaliki. Please, just Google and find out the places we have and send those people there. Repair is free of charge. Feeding, repair, everything about it is free of charge. Do not allow any woman to be with fistula, both leaking urine and leaking feces, and you leave them at home. You're not doing them the right thing. Please, tag them to this video and let them come and have repair free of charge. I mean free from head to toe, from everything to discharge, free of charge. Please do not allow any woman to continue to stay with fistula. Secondly, we advise you, after repair, please do not go and try vaginal delivery anymore. All your deliveries will be through cesarean section. You have as much baby as you want, but please don't try to deliver vaginally, because if you do, you're going to break the repair we did, and we're going to have an issue again. We have seen some people that will not even listen to instruction. We do not allow you to want to get pregnant in the next 6 months. You see them the next thing, they are pregnant, and before you know, they won't even come to the hospital. In my center, we've combined, we are doing both preventive medicine, because we want you to get pregnant. When we repair you and you get pregnant, come and register. Everything about your delivery, antenatal care, delivery of your baby is also free of charge. Please, we do not want any woman to come with VVF or rectovaginal fistula anymore. It's a disheartening condition. No woman will want to go through that. They are stigmatized. Their husband run away from them and go to and marry another woman, and people can't even stay with them because of the stench of what is coming out from them. Please, repair is free in my center. After we have repaired you and you go home, and after recuperating and you get pregnant, I'm telling you that repair, there is page, follow this page, comment and share. Let it get to every woman to hear this. Thank you. Okay, I will want to take you around our obstetric fistula theater. You will see how beautiful it is. It's a very beautiful place where we give these women their life back. Follow me through it. This is Gyne theater. We have a special theater for them. This is the general surgery theater. This is the walkway to our theater. Beautiful place to behold.